Our next presenter is Dr. Toru Nemoto, who is a community psychologist and has been working with Asian and Pacific Islander communities of men who have sex with men and transgender people for substance use and HIV prevention in the San Francisco Bay Area. Also, he has been conducting HIV prevention research for transgender and female sex workers in Asian countries such as Vietnam, Cambodia, Thailand, and Malaysia. Currently, his transgender project team is implementing a motivational enhancement intervention program to assist African American transgender women living with HIV in Oakland, California, to enroll in HIV primary care and increase health and well-being. Dr. Nemoto, your floor.
All right, thank you for the introduction. First, I would like to acknowledge co-authors, Mariko Iwamoto, Sachiko Suzuki, and Cruz. All of us are from Public Health Institute, Oakland, California. A meta-analysis study reported HIV infection seroprevalence rate among transgender women in the United States ranged from 0.5% to 60%, with an estimated prevalence rate of 28%. Transgender women are categorized as the highest risk group for HIV infection in San Francisco, and studies in San Francisco have estimated that HIV prevalence rate from 15% to 35%. And San Francisco HIV Prevention Planning Council identified transgender women as being disproportionately affected by HIV. Studies in San Francisco have found particularly high HIV prevalence rate among African American and Latina transgender women. Studies reported that transgender persons lack access to transgender-sensitive healthcare and often experience transphobia in healthcare and treatment. Transphobia is defined as an individual and institutional discrimination against transgender people based on their gender identity and gender expression. Transgender persons are frequently exposed to violence, sexual assault, and harassment in everyday life, mainly due to transphobia. High prevalence of depression and suicidal ideation and attempts were reported among transgender women. A limited amount of literature has described the prevalence of health disparities, unmet needs, and transphobia among transgender women, particularly those living with HIV. For this study, we used mixed method. First, we conducted focus groups, and then we conducted survey interviews, individual survey interviews. And participants were recruited based on purposive sampling method from the targeted communities, such as bars and clubs and street corners or commercial sex solicitation. Also, we recruited by referrals from the collaborating AIDS service organization in San Francisco and Oakland. We recruited participants in two waves. First, we recruited 332 transgender women, including 112 African American and 110 APIs, Asian Pacific Islanders, and 110 Latino transgender women in San Francisco. Second wave, we recruited 118 Caucasian transgender women in San Francisco and 123 African American transgender women in Oakland. These two cohorts are mainly due to funding restrictions. And the inclusion criteria include self-identified transgender women or transsexual women, including those gender variant people, and also 18 years and over, and history of sex work, and live or work in San Francisco or Oakland, Alameda County. So this study focused on unmet needs among transgender women living with HIV. So we measured 9 items for basic assistance needs, including permanent housing, food, employment, and job training, 4 items for mental health needs, and 1 item for substance abuse treatment needs, and 5 items for healthcare services, including emergency medical services and general medical care, including HIV primary care. We first asked whether a service was needed, and if yes, we asked whether assistance was received. So score 1 for unmet need if expressed need, but service was not received. We also measured psychosocial factors, such as depression, used CESD scale, self-esteem, and transgender community identification, and transphobia. We measured experience of physical, sexual violence, verbal harassment, and discrimination in 2 time periods, 12 to 18 years old, also as an adult. And we modified from homophobia scale. And we also measured perceived need for 5 types of social support from 3 sources of social support, from family members, transgender friend, and non-transgender friend. Also, we measured frequency of 5 types of social support received from 3 sources of social support. So, in this study, we selected a total of 161 participants who self-reported living with HIV from the parents' sample of 573 transgender women. So, as you know, San Francisco attracts many LGBT population to come to live or visit. Also, it's unique in terms of general population. 1/3 of population are Asian Pacific Islanders, 1/3 white, 1/3 Latina or Latino, and 10% for African Americans. So whenever we do HIV prevention research, we must consider cultural or ethnic differences. So this is the demographic differences between ethnic groups. As we expect, Latino and APIs, most of them are immigrant, and we found API and white transgender women, they reported high level of education and income compared to other groups. This is the result of unmet needs. Total unmet needs are significantly different between ethnic groups. White and African American reported higher levels of total unmet needs, so as basic assistance need and healthcare need. So we look at also risk behaviors among transgender women living with HIV. So first one is alcohol use before having had sex, and also we found a significant difference, drug use before having had sex with any type of sex among transgender women living with HIV. We found higher level of we also look at risk behaviors, unprotected deceptive anal sex in the past 30 days, URAS, with primary partners and casual and commercial partners. We found significant ethnic difference or racial ethnic differences in primary partners for URAS. White and African American tend to engage in these risk behaviors. And only African American transgender women living with HIV reported engaging in URAS with commercial partners. And as we expect, risk behaviors significantly intercorrelated. And this is the correlation matrix between unmet needs and risk behaviors. You can see those who reported higher level of unmet needs in basic assistance also tend to report engaging in URAS with commercial sex partners. Also, those who reported higher unmet needs in mental health services tend to report engaging in URAS with commercial partners. Those who reported higher unmet needs tend to be depressed. So we look at the depression among ethnic groups. In general, this samples really higher level of reporting depressive symptoms, and particularly Latino transgender women. like 76% of Latina transgender women are depressed based on CESD scale. So we also look at differences on psychosocial measures. There's no significant group difference of transgender community identity, self-esteem, transphobia, and social support need. And we couldn't find any significant difference receiving social support from family members and transgender friend, but we found significant difference receiving social support from non-transgender friend. So we landed a multiple regression analysis on the total number of unmet needs and African American ethnicity, age, younger age, and transphobia experience and social support needs are strongly and significantly correlated with total number of unmet needs. So summarize this study. This study clearly showed that transgender women living with HIV had high number of unmet needs for basic assistance such as employment, housing, and job training. The overall unmet needs, as well as basic assistance and mental health needs, significantly differed between racial ethnic groups. African American and Caucasian transgender women reported higher unmet needs than Latina and API transgender women. Transgender women living with HIV had engaged in risk behaviors such as URAS with primary partners and drug and alcohol use before having had sex. African American and Caucasian transgender women were more likely to engage in these risk behaviors. Also, these risk behaviors were significantly intercorrelated. It should be noted that transgender women living with HIV who expressed higher needs for basic assistance were more likely to engage in URAS with commercial sex partners. Also, those who expressed unmet needs for mental health services were more likely to engage in substance use before having had sex and URAS with commercial partners. Compared with API, Latina, African American, and Caucasian transgender women living with HIV reported a higher level of depressive symptoms, and depression was significantly correlated with higher unmet needs for healthcare, including HIV primary care. This is a correlational study, but very important implications. Multiple regression analysis reveals that ethnicity, African American, young age, exposure to transphobia, and needs for social support were significantly and independently correlated with unmet need. Limitations of the study include sampling biases whenever we interpret the study result. Recommendations. Future programs for transgender women living with HIV must address their basic needs, such as employment, housing, and job training. Also, programs must target specific groups: Latina, African American, and Caucasian, younger age group, and those who expressed exposure to transphobia, to address and fulfill their unmet need. Mental health issues among transgender women living with HIV must be addressed because unmet needs for health care, including HIV primary care, were significantly correlated with depression. Most of all, individual and institutional transphobia must be eliminated through education for service providers, as well as media campaigns for general populations, because transphobia prevents transgender women living with HIV from seeking help and utilizing health and social services. In the past more than 10 years, we have been closely working with transgender communities, and we are engaging in not only research activities, but also we provide service project based, supported by US government. And this service project really provide us foundation to work with transgender communities. And one project particularly addressed targeting transgender women living with HIV in Auckland. We target African American communities. And right now, almost ending first year, and we surprisingly found more than 80% have not been enrolled in HIV primary care. They know they are infected with HIV, or many of them drop out of HIV primary care. So our health educators closely working then to bridge or re-enroll in HIV primary care using motivational interviewing techniques. So we acknowledge or express thank you for transgender community members, AIDS service organization. Also, particularly, we'd like to express so much help from San Francisco Department of Public Health. And this is our transgender team. Thank you.
Thank you very much for that. Another inspiring talk, and again, I think a really important one for us to be thinking about. In many other parts of the world, the transgender community are really deeply affected by HIV around the world. And I think I'm right in thinking that for the first time for this conference, there's a transgender networking zone in the Global Village. So maybe you would like to go there also and to learn more about this huge issue. So thank you again.